For those who have a prolonged itchiness within the genital region, it is possible you have a yeast or candida infection. A dense discharge in addition to a scratchy sensation is frequently suggestive of this kind of an infection. Many other signs and symptoms consist of an allergy, tenderness or even a burning up sensation, particularly while urinating. Minus the extreme itchiness, even so, there will probably be one other issue apart from the candida or yeast infection. A yeast or candida infection that happens greater than 4 times annually is known as recurrent. Meet with a medical doctor whenever you encounter recurring yeast or candida infections to make sure of the reasons. Be aware of the well-known sparks of the yeast or candida infections so that you can lessen these. Yeast or fungal infections are generally connected with a vulnerable immunity process. In case you are worn out or even overstressed, you may well be at greater risk. Have an abundance of rest to avoid repeated yeast or fungal infections. Substantial stress could affect your own hormonal levels and also enhance your associated risk in the process. Inadequate nourishment, diabetes mellitus as well as being pregnant are also able to enhance the chance connected with recurrent yeast or fungal infections. The contamination may perhaps take place following a health problem or even by using a prescription antibiotic. Whenever ingesting a prescription antibiotic, take into account consuming more yogurt or some other food items having probiotics. Prescription antibiotics have a tendency to destroy the good microorganisms that combats yeast. An unsweetened diet regime is also able to assist lower your odds of obtaining a yeast or fungal infection. When pregnant, your own hormonal shifts place you at heightened risk. Seek advice from your physician with regards to any kind of yeast infection remedies you possibly can take during pregnancy. A minimal yeast or fungal infection frequently occurs by the end of your menstrual period because bodily hormones improve. Yeast or fungal infections can be the effect of an alteration of the genital surroundings, for instance a rise in moisture and heat. Stay away from skinny jeans or apparel within the genital region. Dry yourself speedily following baths and also after going swimming. Swiftly shift clothing right after physical exercise. Genital yeast or fungal infections is treatable using antifungal medications which can be introduced in the vaginal canal as lotions or even suppositories. In the event that one more condition has activated the yeast or fungal infection, then again, you should deal with it first. A lot of women reckon that sexual intercourse will be to attribute to their own yeast or fungal infections. Yet, sexual intercourse just isn't a primary factor for your problem. Ladies who aren't sexually busy nonetheless acquire yeast or fungal infections. Acquiring repeated yeast or fungal infections is seen as an indication of a much more serious medical condition. Seek advice from your physician to define the complexities. As soon as you already know the precipitating factor of your current yeast or fungal infections, you will be able to refrain from its repeat. Do you want to discover the only holistic system in existence that will permanently cure your yeast infection, eliminate candida and let you regain your natural inner balance, using a unique 5-step method no one else will tell you about? The Yeast Infection No More program is the #1 top-selling candida ebook in the history of the Internet. Thousands of women and men of all ages have totally cured their yeast infection condition and gained comprehensive freedom from candida-allied symptoms naturally without drugs, magic potions, creams or just by using the clinically accurate, scientifically proven step-by-step system found in this incredible guidebook. The book link is in description below.